Good afternoon and welcome to the Epilepsy and Wellness webinar put on by the Epilepsy Foundation of Minnesota, an affiliate of the National Epilepsy Foundation. A couple of housekeeping items for you as we get started in this webinar. This is a 1-hour webinar and we will be done promptly at 1 p.m. The bandwidth for this webinar, I would encourage you to close any music or other apps in the background if you are having trouble with your bandwidth and the presentation coming through clearly via your internet. You might want to close down some of those programs. This webinar will allow you to have a certificate of attendance, and that will be sent to you up to 2 business days after the webinar. And that certificate of attendance is for you to keep and to submit if you need to for any further continuing education credits through your work or licensure board. This webinar will be recorded, and so it will be put onto our website within a month after the webinar has occurred. And so I encourage you to share our website, efmn.org, and look for this webinar in the weeks ahead. I do want to let you know that we do not have a tech support person during this webinar, so we will, if you are having any technical difficulties, one thing you can try is to log back out and try to log back in. Sometimes that will help. Most of those technical difficulties will be remedied, though, if you do not have other things open in the background. I do want to let you know that we are a nonprofit organization. We are not a medically trained organization, so all information in this webinar is for educational purposes only. And if you have any questions that are related to your health and your diagnosis, those questions should be asked of your medical physician. You will have several opportunities throughout the presentation to ask questions. We will not be stopping for questions in the middle. We will take questions at the end. And how you can submit any question at any point is to open up that Q&A at the bottom of your screen, the Q&A box. Then you can type in your question at any point, and those will be monitored and answered at the end of the webinar. The chat function has been disabled, so please use that Q&A as the chat function will not work. My name is Amy Haugen, and I'm the Regional Program Manager at the Epilepsy Foundation of Minnesota. I manage staff and programming throughout Greater Minnesota, so non-metro Twin Cities area, providing programs and services within West Central Minnesota to about 20 counties in West Central Minnesota. You can reach me for questions or follow-up after this webinar at amy.haugen@efmn.org or amy.haugen@efmn.org. My phone number 320-203-9722. I've been with the foundation in this role for about 18 months, but prior to this role I did work for 6 years in the Fargo-Moorhead region. I'm also a family member of a child who had epilepsy and passed away from a seizure. So my work is also a big passion of mine. Today's objectives, and you will see this when you get your certificate of attendance as well, is to learn some basic definitions of wellness, to gain knowledge about 8 wellness components, and understand how your epilepsy can impact wellness, and some helpful tips to increase living well with epilepsy. We're going to start out though with a poll question. We like to do poll questions just to get some information from our participants. So I'm going to go ahead and open up our first poll. And you can just click one of these as far as your relationship to epilepsy. What is your relationship to epilepsy? You have epilepsy, you have another family member that has epilepsy, you have a child with epilepsy, a friend or a coworker with epilepsy, you have lost someone to epilepsy, you have a parent that has epilepsy, spouse or a partner, or you work with people with epilepsy. And if you have multiple relationships to epilepsy, just choose what you would consider, the one that is primary for you. We'll give it just a few more seconds and then I'll show you where we are at with our polling. We like to offer polls to you so you can get to know a little bit more about who's on the webinar with you and their relationships for this question. And we like to gauge sort of where you're at with your epilepsy knowledge and awareness. We're going to go ahead and end that poll and I'll share the results. So looks like we have about 75% of our attendees who have a child with epilepsy, and about 25 or 1/4 of our attendees that have epilepsy themselves. Thank you for sharing that important information. So I'm gonna briefly tell you a little bit, a very brief overview of epilepsy and seizures, just so we're all on the same page about what I'm talking about when it comes to the terms epilepsy and the term seizure. So epilepsy is a medical condition diagnosed typically by a neurologist, maybe a family physician or pediatrician, and it's a neurological condition that's characterized by unprovoked reoccurrent seizures. Keywords here, neurological and reoccurring. And so having one seizure in your lifetime more than often than not will not mean that you will get a diagnosis of epilepsy, but when you have reoccurring, that second seizure is typically when we do see physicians start to do some testing to see if you do have what we call epileptiform brain waves or seizure activity happening in the brain. It is also known as a seizure disorder or a condition. So epilepsy is the medical condition. A seizure is a finite event that occurs in the diagnosis of epilepsy and in some other medical conditions as well. So a seizure, what happens during a seizure, it's a sudden misfiring of the neuron cells within the brain. As your brain is functioning, millions of neuron cells are communicating with one another in order for you to do things like walk, talk, your vital signs, your breathing, your heart rate, things like that. When a seizure occurs, neurons are misfiring along the neural pathways, and that misfiring is leading to an outward physical manifestation or a seizure. So they can occur with other conditions. They can be comorbid with some other things that are going on, and they might look different depending on what part of the brain is involved. A full brain seizure or generalized seizure is going to look very different than a focal seizure where it's just one part of the brain that is actually seizing. So now we've defined epilepsy and seizures, we know what we're talking about as far as the medical condition that we are going to be sort of interjecting into this definition of wellness and the impact on wellness. So dictionary.com, the basic definition of wellness is the quality or state of being healthy in body and mind, especially as the result of deliberate effort. And the Global Wellness Institute, there is a Global Wellness Institute, there's also a National Wellness Institute, and they have quoted the World Health Organization, their definition being wellness is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so as you look at these two definitions, wellness it's pretty broad. There's a lot to it, but there's some specific words I just want to point out. Wellness takes effort. In both of these, you see the word deliberate effort, the state of being well, and it's not merely the absence of something. So it takes effort. Wellness in different components of illness require something on our part in order for it to increase in our life. It's also holistic. Our wellness is the whole person. You can see that physical, mental, and social well-being in that definition, but we're going to break it down even further for you and talk about different components of your wellness and the impact of that level of a wellness to your whole being. It also can ebb and flow. And so wellness is not something that's static. It's not like, oh, I'm physically, my physical health is very stable right now. Well, if you go through a period of time where you don't have as good of control over seizures, your physical health that wellness view in that physical health state might be a little bit reduced, right? So it's holistic, it ebbs and flows, and it is one that takes some effort. The National Institute on Wellness is one of the organizations I mentioned earlier, and you will find all of these sources and references at the end of the presentation. But the National Institute on Wellness has these 6 categories that they use to help you determine your dimensions of wellness. And I'm going to just briefly talk about them, and we are actually going to actually delve even further into 8 categories that are considered by the Epilepsy Foundation to be the components for wellness. But the basic ones here are emotional, occupational, physical, spiritual, intellectual, and social. Those are pretty broad categories. But when you think about your wellness and your level of wellness in each of those, and the practices you have for wellness, maybe you are somebody for your physical wellness, you choose an activity like yoga, or you choose to run, or things like that. Keep in mind as you look at each of these components, thinking about your wellness level in them, it should help you reach your full potential. So let's say in your occupational world, you choose a position that really is quite stressful, you don't enjoy, it's not a good fit. Would that practice and that job really help you reach your full potential? You got to consider that when you're thinking about your wellness practices. Does it also promote my positive attributes? We all have positives and negatives about ourselves, right? And so will this wellness practice in each of these categories promote the positive parts of yourself? And does it take into account your whole self? So when we think about wellness as a whole, there are three kind of questions that many wellness practices and wellness organizations and nonprofits think about. And these are the three: the reaching the full potential, promoting your positive traits, and taking into account your whole self. As we look, we're going to move into the epilepsy community as a specific category, a specific community, because that is the purpose of this webinar. And when we think about the epilepsy community, back in 2016, between September and November, the National Foundation, the Epilepsy Foundation of America, it's epilepsy.com, put out a survey asking people with epilepsy a couple of questions. The questions that they asked were, what are the aspects of epilepsy that have the greatest impact on you? And where should we as researchers focus? And what are the biggest frustrations with having epilepsy? And what is your biggest hope in the next 5 years as a person living with epilepsy or a person impacted by epilepsy? So they asked these 4 questions, and that was sort of the purpose of the whole survey. What they came back, you can see some statistics here, that they had over 1,000 respondents. Every state in the United States was represented, and they also had about 41 international respondents as well. And you can see the breakdown here of who was actually living with epilepsy, who was a family or caregiver, and then who was over the age of 20, so the adult population. The top results out of these 3 questions, when the responders were given, multiple choice, the 2 top results that came out were the respondents overwhelmingly obviously wanted the number one thing to be to stop seizures. I think that as a person with epilepsy or a family member of a person with epilepsy, that is always the number one goal, right? And the number one sort of hoped for outcome is that seizures will be stopped. But when they talked about what's the second thing that people wanted to know about epilepsy, or about what did they want researchers to know about their experience with epilepsy? And the second top result truly was, we want you to focus on how do we improve the quality of life for those living with epilepsy. So out of this whole survey came a concerted effort by the EFA to put wellness at the top of their sort of radar. And as an affiliate of that national foundation, we then were able to sort of take into their programs and utilize them as well. So they created this institute called the Epilepsy Wellness Institute. And I'm going to show you, it's a brief video by Greg Grunberg, who's an actor, and he talks about what does it mean to live well with epilepsy and all of the wellness categories. But what I'm going to do first is I'm going to actually ask you a second poll question. And this poll question kind of sets up the information that we're going to share next. So I'm going to launch this poll, and there's 8, I'll show you this in just a minute, there's 8 sort of categories of, or dimensions of wellness. We talked about 6 from the National Wellness Institute, but this has, in the Epilepsy Wellness Institute, there's 8. So go ahead and read through these and choose which one you find the most challenging. As you look at your wellness overall, is it your emotional health, your stress management, your sleep, your diet and nutrition, physical activity, social relationships, independent living, social relationships, education, and or employment? Is there one within that stands out as the most difficult or most challenging for you? So we'll go ahead and give you just about 30 seconds to think through that. And I know you might say, well, can I pick more than one? Because, right, that would be ideal. Well, this will just give us a little bit of an idea as to where everyone's landing in what is the most difficult for them right now, or the most challenging. Just a couple more seconds here, and then I'll share our results. And there's no right or wrong answer. And just so you know, these polls are absolutely anonymous, so I can't see who's answering what, and neither will you be able to see. So it's just good to get everybody's input here and see where they're at. I'm just going to give it another 5-10 seconds, because it looks like we have maybe a couple people who haven't responded. All right, I'll go ahead and share these results with you, which are really interesting to me. Like we hit the mark as far as covering pretty much every category except for sleep, physical activity, and independent living. So this should show you and really reiterates the point that our wellness is really individual to us, and our perception of where we're at in each of these categories is really individual. And that's why we talk about it as a whole. So we're gonna walk through these 8 categories together. So hopefully whatever you chose, you'll gain some new insights and tips there. All right. We're gonna move on now to, pardon me. The Epilepsy Wellness Institute is the wellness institute I was speaking about that the National Foundation actually put together after this community survey. And what they did is they put together these 8 components that we just polled you on. And really what they wanted to make sure is that as you look at your dimensions of wellness, it's those same things. How does it impact your overall health and well-being as an individual with epilepsy? Does your epilepsy diagnosis impact any or all of the dimensions? Well, the answer is yes. Epilepsy can impact any and all of those dimensions, depending on where you're at with your journey. And it also can impact your ability to manage your epilepsy and your seizures, right? Self-management is really important when it comes to epilepsy. And so wellness in any or all of these dimensions, your level of awareness, can impact your self-management of your health condition of epilepsy. So self-management, just to give you a little bit of background on this, is self-management is not just about how do you manage the treatment of your epilepsy or how controlled are your seizures. Self-management also looks at things like, how is this impacting your life? How is, what is your circle of support that's helping you with this? It's sort of that sum total of all components that go into your diagnosis. And we all have different impact of epilepsy on our lives. And so as we look at that, there are 3 sort of stages to self-management and considering where you're at in your self-management. First of all, when you're first diagnosed, the first self-management piece of epilepsy is how are you processing the diagnosis that you've just received? Or if you've had epilepsy for a long time, how are you continually processing the feelings and emotions you have about it, and that level of impact on your life? And then the sort of second stage is to identify what kind of strategies can you use to manage your diagnosis. What are you going to need to manage? Are you going to need people of support, where if you can't drive, who's going to help you get to appointments? How are you going to manage if you are in a work setting and you need someone to respond to a seizure you're having? So it's coming up with those strategies. And then the third sort of stage is the acceptance and setting your frame of mind as to, yes, I have this disorder. This is how I'm going to manage it, how I'm going to live well with it. And so there are ebbs and flows, again, in all of these, depending on where you're at and how your seizure management and your seizure control fluctuates. And so know that self-management is also really foundational to the work we do towards wellness. And it's ongoing. It's an ongoing work, as you all know. So now I'm going to show you this clip. It's about a 4-minute clip, and I want to share with you this because it really will give you an introduction to the 8 components that we're going to talk about. Let's see. Oh, pardon me. We'll get there.
Hi, I'm Greg Grunberg, actor, epilepsy advocate, father of a young adult with epilepsy. I'd like to take the next couple of minutes to talk to you about wellness. Wellness means having a healthy mind, body, and healthy feelings, resulting in an overall sense of well-being. Making health a priority is essential to a happy and full life. Wellness is important for all of us, but even more so for people with epilepsy. Did you know that 1 in 26 people will develop epilepsy at some point in their life? A chronic health condition like epilepsy and its treatments can affect your health, well-being, and your daily life. If you live with epilepsy, improving aspects of your wellness may help with brain health and seizure control. Sometimes what you eat, not getting enough sleep, how you manage your stress, and other factors can affect your seizures, so it's important to pay attention to your daily habits and lifestyle. And for people who care for someone with epilepsy, focusing on your own wellness can recharge your batteries and allow you to provide more effective support. The Epilepsy Foundation's Wellness Institute focuses on 8 parts of wellness: independent living, emotional health, diet and nutrition, stress management, sleep, social relationships, education and employment, and physical activity. For more information about each of these parts, visit epilepsy.com/wellness. A well-rounded approach to wellness may have the following benefits: lower healthcare costs, a stronger body, healthier brain, less stress, improved emotional health, and a better frame of mind to tackle day-to-day activities. Just as wellness affects epilepsy, epilepsy can also affect your wellness. In particular, uncontrolled seizures can make it difficult to achieve wellness in the different parts we mentioned in the wheel, such as getting a job, education, or living on your own. Medications can be an effective way to control seizures, but 1/3 of people with epilepsy have drug-resistant epilepsy, meaning that their seizures are not well controlled by medications. Research shows that people with drug-resistant epilepsy have more challenges and lower quality of life than people whose seizures are controlled with medications. Don't worry. If seizure medications aren't working, don't give up. Seeing an epileptologist or an epilepsy specialist can help you find the best way to control your epilepsy. We've learned about how epilepsy and wellness affect each other. What's next? One of the first steps in a journey toward wellness is talking about your epilepsy with people who care about you. Don't keep it to yourself. That can be isolating and lonely. Talk about it. Talk about it with your family, schoolmates, colleagues, friends, with whomever you feel comfortable. Let them give you that support and the encouragement that you deserve. Who knows? You may learn that someone else you know also has epilepsy. Another great way to connect with people and find support is to get involved with your local Epilepsy Foundation. There are over 50 Epilepsy Foundation offices nationwide. Visit epilepsy.com/local to find the location closest to you. Your local Epilepsy Foundation provides tools, resources, and opportunities to connect with other like-minded people and learn more about your health and wellness. It's also important to learn as much as you can about epilepsy. Knowledge is power. So visit epilepsy.com to learn about all the tools and resources available to you with just the click of a button. It can be hard to know where to begin in your wellness journey, but if you have a positive attitude, you will gain the confidence to make the small changes to improve your wellness and epilepsy. And remember, wellness is a journey. Each day is a new opportunity to improve your wellness. The small choices we make daily can contribute to our overall health, happiness, and well-being. Best of luck.
All right. I'm going to click out of that so we don't have another one start. So as we think about the components of wellness that were discussed in that video, very briefly, we're going to delve into each one of them. The first one we're going to talk about is emotional health. A few of these will have a little bit more information than other areas, but when we think about emotional health is really not just the feelings and moods and behaviors we have, but our awareness of them, right? So we might have moments where we're very angry, or we're very sad, or we're very elated over something that is positive in our lives, and it's the feelings we have, but it's also the awareness of those feelings and the impact of that particular feeling on your life and on your actions, right? So as we think about quality of life with an epilepsy diagnosis and emotional health, epilepsy, obviously, as many of you know, can have an impact on your quality of life. It can be the quality of life of your body and mind maybe not being as reliable for you. Epilepsy diagnosis might have an impact on your self-image, or it might be seen as something you have to a new thing to manage, another extra thing. And so that quality of life can fluctuate your view of your quality of life based on the impact of that epilepsy on your day-to-day life. It can also have an impact on your quality of life because maybe there were things that you loved to do in the past, or maybe there were hopes you had for what your child would be able to accomplish in life. And that diagnosis of epilepsy may have changed that a little bit or a lot, and that can impact your emotional health as well. We do know that there are particular mental health and emotional health conditions that are comorbid with epilepsy. Comorbid just means that if you have one, you are at a higher risk of developing the other. And so we know that in the world of epilepsy, about 50 to 60% of anyone who has epilepsy will at some point along their journey of after diagnosis have depression or anxiety. Depression is really about unrealistic negative views of yourself in the world, whereas anxiety is that irrational sort of fear and dread that you feel. So when we talk about 50 to 60% of people with epilepsy also having a emotional health condition, there's lots of reasons for that. It could be that the impact truly on your life has led to some depression or anxiety. If you cannot work any longer or your seizures are not controlled, that's going to impact probably your mood and your mental health. It could though also be because where your seizures are coming from are from that center of the brain that is in charge of mood and emotion. So if you have misfiring in your emotional center of your brain, you may have mood changes. And then finally, as you may know, that the treatment options are varied for epilepsy, but medication being one of those treatment options. Some of the medications that work well for epilepsy have mood side effects. And so we know that some of that 50 to 60% is also experiencing the emotional health conditions because of the impact and side effects of their treatments. So those are all a number of things. We know that it can also impact your memory. And so oftentimes that can impact your quality of life with epilepsy and your emotional health if you are struggling with memory concerns. If you find yourself more isolated with your epilepsy diagnosis, or you feel discriminated against, or you feel stigma of any kind. Stigma is a broad term for any sort of feeling discriminated or persecuted for what you're experiencing, that you aren't like others. And so those all can play into your emotional health component of your overall wellness. So what do we do? So we've talked about all of those things that can impact your emotional health, but what do we do about improving our emotional health? Well, emotional health, there's lots of things components to it, as well as, you can improve your health by emotional health through physical activity. Your circle of support can help you. If you get enough rest, if you practice mindfulness and gratitude, all of those things can play into the level of emotional health you feel at any given time. But some standard things to think about is, how much do you actually talk about emotional health with others? Not necessarily yours, but emotional health in general. How much do you talk about, what is your emotional health and what components go into it, and why are you at a certain level than another person? So the more we talk about emotional health, the more we will get healthier in this field, because we will not feel as isolated. You have to acknowledge your emotions, right? So you acknowledge what you're actually feeling and accept that maybe right now you're very angry, whereas you know, last night you were feeling pretty elated about something. Epilepsy's got that ebb and flow, up and down impact on your emotions. And so knowing that you're going to have this whole wide gamut of emotions is a good thing. You can journal your daily moods, looking for patterns, seeing if there's patterns before seizures, patterns after seizures, time of day. Do you feel a certain way versus, you know, is it easier in the morning versus the evening, those kinds of things. So tracking sort of where you're at emotionally by journaling will help you look at the areas where you're maybe a little bit lower, and sort of brainstorm and problem solve on ways that you can deal with those times of the day or those particular situations. One thing you do want to do if you have epilepsy and you're experiencing some major mood side effects, potentially, or major mood changes, making sure you're sharing that with your medical provider, because you might want to ask, is this an effect of where my seizures are coming from or the medication that I'm taking? Our tip number 2, or excuse me, our dimension number 2, the second of 8, is called stress management. And you know, stress is a wide array of things depending on the person. And so the Cleveland Clinic, and again, these references are at the end of this presentation, but the Cleveland Clinic defines stress as the body's reaction to any change that requires an adjustment or response. So here again, it's a reaction, so it's not static. Our stress level is directly related to how we're responding to changes that happen in our environment, and those changes require adjustment or a response. And so as you have to adjust to a new diagnosis, as you have to adjust to, you know, a change in your seizure control, a new treatment, all of that, you will probably experience some stress, right? Because of that is just a natural reaction that occurs. There are good stressors in life. When you think about good stress, think about things like a birth of a child. It's very stressful, but it's a positive typically. Running a race, getting a job promotion, all of those things can be positive, good stress. So not all stress is bad, but bad stress or the negative stress can be things like when you have relationship conflicts, financial concerns, you have a physical like heart attack or any other kind of physical stressor on your body that is not positive. Those can be bad stress as well. So when you're thinking about how you manage everything, know that you will have those good and those bad kind of components. The impact of your stress on epilepsy, like on you as a person with epilepsy or a person who is helping care for someone with epilepsy, stress can be a trigger. And like I said earlier, that stress is super individual, right? It's a bit of an ambiguous word in that, you know, it's a broad definition there. And so what my stress is going to be very different than your stress. And so if you have stress as a trigger, or you know that your loved one's trigger is stress, delve into what does that mean? What kinds of stress? What are the dimensions of that stress? Is this a physical or emotional? And how do we build up our sort of bucket of strategies to deal with that kind of stress? That's really key as well. Some coping strategies to think about when it comes to stress are taking good care of yourself. Self-care can be physical self-care, it can be emotional self-care, taking a break. If you're in a stressful situation, removing yourself and taking a 10-minute break where you are just breathing and focusing on your breath and your equilibrium of your stress level. Talking to others, of course, can be key for many people on coping with stress. Just actually verbalizing what you're experiencing may be helpful to you, even if you don't receive back, you know, suggestions for how to handle it. Sometimes just talking through it is really important. Avoiding alcohol and drugs, which can compound the feelings of stress, or maybe even if that reduces your stress level, it doesn't eliminate it, right? So after you have used that alcohol or drugs, you might find that your stress level has increased in the after effects of it. And then always recognizing when you think that you should be seeking some professional help. Some stressors are significant in their impact on us, and as that significant impact impacts our lives, we may need to seek some professional help, such as counseling, and that is very normal strategy, and it's actually a very healthy strategy if you have stress that's out of control. We're going to launch our third question now. And the third question to me is one of the most interesting ones because we're going to get into talking about sleep. And so I'm going to launch this, and it's, again, you know, this is anonymous. So I'm going to go ahead and launch this poll, and it's really getting a gauge on how many hours of sleep do you get at night. So do you get less than 6, 6 to 8, or over 8? And I'll explain why this is important in just a bit. So I'll give you just a little bit of time here to answer this question. How much sleep do you get on average per night? Just give it a few more seconds. All right, I'm going to go ahead and close that poll and share those results with you. So the majority of our group gets 6 to 8 hours. About 60% of us get 6 to 8 hours of sleep per night. Another 40% of us get over 8 hours. So what's interesting in this poll is that nobody gets less than 6 hours on average. That's fantastic. I'm going to just tell you that that is fantastic. When we start talking about sleep, you'll understand why. But thank you for sharing that information with me. When we talk about sleep, there's a CDC, according to the CDC, and again, you can find this resource at the end, they have some recommendations about how much sleep should the average adult get, how much average number of hours. And they say that adults need at least 7 or more hours to really have their best health outcomes and well-being outcomes. And so 7 or more hours, so that's why I said it's great that our whole poll was, you know, 6 or more, actually. But they also talk about the quality of sleep that you get. So if you are a person, your quality of sleep isn't great, like you wake up multiple times, perhaps you're a snorer, perhaps you have sleep apnea, maybe your partner has sleep apnea or snores, or maybe you wake frequently to use the bathroom, or you struggle to fall asleep, that sort of quality of sleep is just as important as quantity of sleep when it comes to sleep being a part of your whole wellness sort of wheel there. The reality of sleep, though, is that when CDC is that, you know, makes these recommendations, there's a 2014 study that I'm going to show you in just a minute. It showed that over 35% of adults get less than 7 hours of sleep a night. And so you know, sleep deprivation or short sleep duration is considered less than 7 hours. This is an example of a graphic from that study, and I chose this one because if you look at it, it's the United States, and it's actually, you can't tell this, but it's a county by county. Every county is colored a certain color in the whole United States, and so the lighter the color, the lower the sleep deprivation. So we in Minnesota look pretty good. We have one of the lowest occurrences of sleep deprivation or short sleep duration. You know, obviously in the East Coast and Southeast, they have the highest sleep deprivation percentages. Not sure why that is, but you can see across the country there's pockets as well that have. North Dakota has a couple of counties that have that highest level, but the rest of that state looks pretty good in their sleep deprivation. When the same study looked at some other characteristics as far as breaking it down, men and women, it was pretty equal as far as who had less than 7 hours of sleep. But when you look at the age group that has the highest percentage of people getting less than 7 hours of sleep is the 45 to 54-year-olds. You could put 35 to 44 there too. It's that category is not too different. And when you look at race and ethnicity, the highest is Native Hawaiian or Pacific Island Americans or Black Americans by significant, over 12% higher than white Americans and Hispanic. And so there are sleep disparities across races, and it's good to know that, because depending on you and the impact of sleep on your epilepsy, you have some things that are sort of inherent in who you are that puts you at higher risk of sleep deprivation. So what we think about for sleep is it's key for overall health. I think a lot of us know that there are so many studies out there and so much information telling us that sleep, you have to get enough sleep for your overall health. Lack of sleep, like we talked about, could be a trigger. There are certain epilepsy syndromes that are associated with sleep, and what I mean by that is that there are certain syndromes that have seizures that occur going into sleep and coming out of sleep, so they can disrupt the quality of the sleep you're getting. Keep in mind also that the treatment options that are out there can impact your sleep quality as well and your sleep wellness. So this is be the impact of your epilepsy on your sleep. Maybe some of them have drowsiness side effects, or difficulty falling asleep as a side effect you're experiencing. So there's lots of ways that sleep can impact your epilepsy, and vice versa, your epilepsy can impact your sleep. Some habits to get into for some healthy sleep habits, which can be really difficult. Being consistent on when you go to bed and when you wake up. Maybe you've heard that before, but that can lead to getting your body into a rhythm of how much sleep you're getting and needing every night. If you didn't know, getting some sun can help you with sleep habits, because it helps release the melatonin in your natural body, melatonin, and melatonin helps you sleep better. And then thinking about some of the things that you do for pre-sleep routines. Do you read? Do you take a warm bath? Do you use aromatherapy? Do you have a TV in your bedroom? Do you have your phones in your room at night? Because the electronics in the sleeping space can really impact your sleep. And that can be a hard one to kind of break that habit. And do you have an inviting sleep space? Do you want to go into your room or your space to go to sleep? Do you have comfortable blankets and pillows and all those sorts of things that will help promote healthy sleep? We're moving into the fourth component of wellness as it relates to epilepsy, and that's diet and nutrition. When you think about healthy eating, the things that you eat every day, think about how you feel. If you have a day that's heavy in processed foods, in carbs, in fast food, things like that, or snacks, you might feel very different than if you have a day that's filled with more whole foods or healthy foods, right? Your actual physical health, how you feel, will be impacted. But really, it's pretty simple. When you eat whole foods or unprocessed foods, it's got a more positive outcome for many people. But when you have poorer eating habits, it can impact a lot of things, and it can actually increase your chances for health conditions that are related to your heart. Your chances for certain kinds of cancer increase. If you have a poor diet, you can also be dealing with some things related to diabetes and your blood sugar, and it can impact your sleep as well as sometimes increasing your seizures. It's really individual to the person, but we do know that in the world of epilepsy, your diet can play a part in this. Some tips that are suggested through epilepsy.com are to, many of us will think, oh, I just got to get on a diet because I do need to lose weight, or maybe if I just change, what I'm eating and eat, all whole foods all at once, that's going to help me. Well, keep in mind that those sort of all or nothing practices that you might have put into play might not help you be successful. Changing things one at a time might be more successful. So I'm going to stop drinking diet soda. I'm going to add in another vegetable every day. Doing one at a time, getting yourself successful can be good, a slow but steady sort of path towards more health in your diet. And again, enlisting those around you who can support you. So getting a team of people who want to eat healthier as well and want you to succeed as you want them to. These other things are pretty self-explanatory, of eliminating your simple sugars, processed sugars, and eating whole foods, and of course lots of hydration, staying hydrated. I do want to remind you that at any point you can open the Q&A tab at the bottom of your screen and type in any questions that you might have. When we talk about this next component of wellness, physical activity, so there's lots of benefits that we can get from physical activity. This is just a little infographic that shows you that you can lower your blood pressure, have a healthy weight. It helps you with your positive mental health and releasing endorphins, reducing your chance of cancer. It can also help increase your strength and your ability to function and your endurance, right? And also can help reduce some of those risks of dementia, and which is really quite interesting as you age, and improve your bone health as well. So know that there's lots of benefits, right? One of the things to keep in mind when you're diagnosed with epilepsy is that just because you are diagnosed does not negate the importance of physical activity for you. You might have to change up your physical activity. You might not be able to rock climb, but maybe you can still do running, or you can choose cycling, or an activity that you're able to be successful in. And choose something you like. I can't tell you how many times people I know and myself choose, oh, I'm going to do this activity and I don't even like it, and then I don't stick with it. So really enjoyable activity will help you stick with it to be more successful. We get lots of questions about exercise, and one thing I'll say is if you have questions related specifically to your physical or exercise or activity and your epilepsy diagnosis, those are great questions to ask your healthcare provider. Things like, can the exercise I want to do trigger a seizure? So asking those questions, is there anything in this physical exercise I'm doing that could potentially trigger a seizure? Are there some that you need to avoid, or are there some that you need to have actually some modifications to? As if you think of sports, organized sports and team sports, there are sports that may need to have accommodations made if you're going to play them with epilepsy. Maybe it's a specific sort of helmet you have to wear, or there's other types of accommodations. And so keeping those in mind. And then the other question you might want to ask the healthcare provider is, if I start to exercise and I really get into this great routine, my metabolism is probably going to increase, right? And is that going to impact your medications if you're taking them and how they're metabolized in the blood? So keeping in mind some of those things that you can ask your healthcare provider. All right, that's physical activity. So we're gonna move into number 7 in our actual components of wellness, and this is independent living. We could probably do, and we have done actually, webinars at the Epilepsy Foundation about safety and independent living with epilepsy. So we could do a whole presentation on independent living. But when you think about independent living, here's an interesting statistic. About 20% of adults who have active epilepsy, meaning their epilepsy is currently impacting their life, whether they have partial seizure control, they have full control because they're taking medications, or they don't have control at all. About 20% of people that are adults with active epilepsy live by themselves. Now, you know, it might seem like a small number who live alone, but when you take into, you know, factors of families and things like that, that you can understand that 20%. But key things to think about if you fall within that 20%, or you want to, maybe you are a young adult who's thinking, I would like to move out and live on my own, but I'm not sure if I am going to be able to with my epilepsy. There's things to think about. Think about your level of control and your seizure frequency. How often are you having those seizures? And what do they look like? If you are by yourself, does that put you at a higher risk for things like SUDEP or injury or things like that because your seizures aren't well controlled? And what is your postictal period like? What is your recovery period? You stop seizing, and what it typically happens for you? And is that something that you might need to put into place in your independent living, a sort of it's something that will help you with that, be it like an alarm, a seizure alarm, or a monitor of some kind. What is the impact of your seizures on your life, and can you financially afford to live on your own by yourself and take care of everything you have to financially? You know, one thing I'll say in all of these is that we have lots of resources for many of these different things, as far as like referrals to places that can help you discuss things like finances and living on your own, and getting seizure monitors and seizure apps and trackers and things like that. So know that there's lots of things we can do to help support you with that and get you the resources you need. What is the cognitive impact of your seizures? Do you have memory loss with it? Are you losing some of your cognitive abilities? That might impact whether you can live on your own. And who is your circle of support? So you can live on your own, but do you have people that could come to your assistance should you need someone to be there in a short period of time? So those are some considerations to think about. But independent living is really a wellness component, because we all want to be successful and be able to manage on our own. And so it's important to realize that it's a component to consider. Some things some other tips to have are having a seizure action plan readily available in case someone does have to come in, or someone is in your apartment building maybe and knows that you've had a seizure, and they come in to respond. Having your action plan readily available and visible in your apartment or in your home so that they can access that. And then you might want to consider an alert device. There's watches, wearable devices that show heart rate, show oxygen levels, and there are some that have motion sort of detectors for certain specific types of motion. And then prepare your living space, rounded corners of things, not having a lot of scatter rugs where you could slide and trip, avoiding, temperature issues like a really hot shower where you could burn or scald yourself if you had a seizure in the shower. And then also knowing your triggers, like what is it that's going to trigger you, and how you live independently, knowing that you have those triggers, and what can you put in place to reduce those triggers. Our seventh component is social relationships. And again, this is one that we could talk a lot about, but really there's a lot of benefits to having healthy relationships, but sometimes it can be difficult with a diagnosis of epilepsy. And so looking at these benefits, there's things that naturally healthy friendships can do for us. They can help us cope with many things in our life and increase our sense of self and our happiness and reduce our stress. They can help us in our healthy lifestyle choices as well. If we are known to be healthy because of our friends, our friendships and our activities we do with our friends, that's a boost to our overall health and wellness. There's also some characteristics to look for in healthy social relationships, and that's key too, because as a person living with a health condition, you want to be able to say that, I feel like I'm in these relationships that are healthy. We have a reciprocal relationship where we communicate honestly, we listen without judging each other, we make time for each other, we remember things about each other's lives, and really engage in healthy conversation and lifestyle choices. And so it's key to know who are those people that are your good social friends that will support you and are healthy for you as well. And interestingly enough, one of the things that we offer at Epilepsy Foundation is our Connect groups. And so one of the things about our Connect groups is that we bring people together in a safe space to meet each other and learn and share experiences. So that's a great way to build on some of those social relationships. The last component is education and employment. And so I'm going to go through this and let you know that education, we talk about these two together because there's sort of that, what do we do with our lives outside of our own sort of bubble of our family and our living situation. So many people living with epilepsy are in an educational system, many are employed. And so a CDC study showed that students with epilepsy missed 11 more days of school than students with other health concerns. This would be high school and below. And so we do know that students with epilepsy are missing more days than other students, but that oftentimes has to do with their level of control, with their seizures, the need for recovery after a seizure, and also, the increase in a number of appointments that a person can have and have to miss some school. But it's an individual experience as far as education. One of the things we've worked at the Epilepsy Foundation is really providing some good supports for educational success. And so on our website, you can click on our trainings, and there's an education, not trainings, excuse me. You can, I believe it's tools, and you can look at our resource library and you can look at our educational services page. It's a new page for the current pandemic, but it's going to show you lots of information and suggestions about action plans if you think that you need to advocate for an IEP or a 504 plan in the school setting. And also, if you are college age, what is the impact on your life of your seizures in that setting? And is there a disability office that you can work with that will help you with things like accommodations and things like that? And you can see support and training is the tab that you would find all of these under from our website. We're going to do one quick final poll, and it's a true or false. So I'm going to launch this last one before we roll through our last slides. And so I'm just going to put it out there. And so currently, epilepsy is a health condition protected under the Americans with Disability Act, or the ADA. Go ahead and vote yes, or true or false. Again, it's anonymous. Give you a few more minutes to actually vote. Okay. A few more seconds, excuse me. All right. Go ahead and end that poll. We are all correct. 100% of us answered correctly that it is protected under the Americans with Disability Act. So let me tell you briefly about employment, and I'll share with you some opportunities we have as well for specific to employment. So when looking at employment for adults or young adults or even teenagers, about 46% of people with active epilepsy that are of the adult age, 18 and over, are either unemployed or underemployed. So we know that there is a huge population living with epilepsy that's not employed or they're underemployed. And so one of the things that we want to think about is why is that, and what should we be providing as resources as a nonprofit serving people with epilepsy. And so we have an employment program where our information services coordinator takes lots of questions about how do I know what to ask for as far as accommodations. What does it mean to have epilepsy in a workplace? What questions should I ask? Do I have to disclose? Which no, you don't, but finding out all of that information about job seeking and actually having a job, we can help you with all of that. I've listed a couple of things here on the right side about what you should consider when you are seeking employment, or if you're in a job. Are there safety sensitive jobs? Is there anything that in a job that you would need to be aware of that might impact your ability to do the work if you had a seizure? I think of like slippery surfaces, or, you know, do you have to climb ladders a lot if you have uncontrolled seizures? That might not work, things like that. And then considering, you know, what accommodations can you ask for? There's this great website called askjan.org. You can go to that website and type in epilepsy, and it will give you great reference resources for how to think about accommodations in any type of job and some of the legal precedents for it. Disclosing, do you disclose that you have epilepsy? You're not required to, and employers are not allowed to ask those kinds of questions in the interview, but at some point you probably will want to disclose so that you have the somebody who knows how to respond. There are people who benefit from vocational rehab services too, that sort of partnership with helping you find a job or find a job that fits your skills and your abilities. And if you at any point feel like you're in a job where you're being discriminated against, you do have legal rights, and so we can help with that as well in lining you up or setting you up and giving you contacts that are in the legal world about if you feel like you have a case for discrimination as well. So in summary, before we take a few questions, just want to give you a couple more definitions because I think these are fantastic definitions for wellness. The Global Wellness Institute had another wellness definition that said the active pursuit of activities, choices, and lifestyles that lead a state of holistic health. And then the Epilepsy Wellness Institute says that wellness is a well-rounded approach that empowers individuals to take an active and engaged role in their health care, which is important for self-management, improving epilepsy and wellness outcomes. So we know that when we look at all of these 8 components, when we consider where are we sort of struggling and how can we help ourselves in those 8 components, it will lead to an overall holistic improved health setting. I do want to let you know about that information services. This is the contact information for it, and you will get a PDF of this handout afterwards that'll have all these links and resources. We are an affiliate of the National Foundation with our mission statement being that we lead the fight to overcome challenges of living with epilepsy and accelerating therapies to stop seizures, find cures, and save lives. You can find us at efmn.org. We also have a used goods department where you can donate used goods to us, or you can make a donation as well. I'm going to go through my references here for you to look in the questions. I know I see a question or two here, so we're going to go ahead and answer that question before we're done for the day. We have one that says, have you seen young people grow out of seizures or just stop having them altogether? I have had childhood seizures at 17 after concussions, and now 21 not had any. So again, epilepsies are really individual, and seizures are very individual diagnoses. And so what we have seen is there are certain types of seizures that we might see someone have in their early childhood and then stop having. We never say you're cured of epilepsy because there is not a cure, but we do know that people go through periods. Some people go through a period where they stop having them and they never have them again. Some people will stop having their seizures and then start having them later on in life if there's something that stresses their brain enough to trigger a seizure. Keep in mind, though, that again, it's really individual, and so if the cause of the seizures is the concussions, I would speak to your doctor about, you know, the concussions, did they lead to the seizures, and is it that her brain has healed? Because concussions can be, you know, the brain can heal from that for some people, and that could be why she's not having them. It could have been related directly to those concussions, and it's not a condition that's going to occur future in her future, because that sort of cause has been removed. Another great example of that is that we have people who've had encephalitis or meningitis. Those are two big causes of seizures. But what happens is you might have seizures during, you might be diagnosed with that infection, have seizures during it. You're cured of the infection through medications and things, and you might never have seizures again. But we also know we have people who had meningitis as children, and as adults they still have seizures. So again, super individual to the person and their diagnosis. So one other question I see is, where can I find any of this information? So what I'm going to do afterwards is I will send out to you a follow-up email, and in that email you'll have some handouts, and there's going to be some great handouts for you from the Wellness Institute, as well as a handout, just some basic wellness handouts that are some of the references I've from this presentation. You should get that in 1 to 2 business days, and then it'll have my contact information on there as well as a PDF handout of this presentation. And from there, if you have questions, please feel free to reach out. We are here to help and to provide any resources we can. We are looking right at 1 o'clock. Thank you for joining us for this webinar. If you have questions, please reach out to us, efmn.org. Have a great rest of your day.